Reverend Honorable Vice Chancellor Sir, respected distinguished guests, scholars, and our participants, a very good afternoon to all. With immense pleasure and gratitude, we welcome you all to the valedictory session of the Northeastern Regional Conference of the Indian Association for the Study of Population, jointly organized with SRM University Sikkim. Over the past 2 days, we have been deeply engaged in deliberations around the theme demography, health, and development, insights from Northeast India. This conference has brought together scholars, practitioners, and researchers from across the country to explore the dynamic intersections of population studies, public health, and regional development, particularly within the unique context of Northeast India. As we come to the close of this intellectually enriching journey, today's valedictory session stands as a moment of reflection, celebration, and acknowledgement. We are honored to have with us distinct dignitaries whose presence graces this ceremonial closing ceremony. I request the audience to please join me in welcoming Professor C.H. Satish Kumar, Honorable Vice Chancellor, SRM University Sikkim, Professor Suresh Sharma, President IASP, Dr. Ajay P. Singh, Joint Secretary and Regional Coordinator IASP, Dr. Anil Chandran, General Secretary IASP, and Dr. Jitendra Yadav Sir, Treasurer IASP. To begin our session formally, I now invite Professor Suresh Sharma, President of IASP, to deliver his welcome address.
Good afternoon, everyone. And first of all, I would like to very warm welcome to our Honorable Vice Chancellor, Professor Satish Chaudhary, and speakers, presenters, and dignitaries for their contribution of this 2 days, Northeastern Conference. Now we are going to close this meaningful, 2 days Northeastern Conference. So first, I would like to thanks, for SRM University, especially my thanks to Professor Satish Chaudhary and Professor Thomas and Dr. Kinkar and his team, and volunteers. They have rarely and very hard work day and night for successful this conference. So kindly, I request you all the participants and the and hope we had enriched discussion on demography, health and development in the Northeast. Your insight and we make every meaningful discussion last 1.5 days. I hope all the participants will be benefited for presenting a paper and listening and comments and all the things. I hope you are going for good memory going to the home. So before welcoming, I request to my senior colleagues, Professor N.S. Bist, welcome to Professor Chaudhary. Actually, so once up on behalf of ISP, my teenage committee there. Once again, I would like to thanks and very warm welcome and looking for the continuing for journey together for research and policy. And I can say safe travel and best wishes for all. Thank you very much.
Thank you, sir, for your warm and thoughtful word. Next, we have the conference report presenting a summary of the key discussions and insights from the past session, for which may I request Professor Tom K. Thomas, HOD of School Public Health, SRM University Sikkim, to present the conference report.
Honorable Vice Chancellor, SRM University Sikkim, Dr. Satish Kumar, Dr. Suresh Sharma, President IASP, other respected dignitaries on the dais, esteemed colleagues, other researchers from across the country, students, and my dear friends. As we bring to a close to this two-day academic gathering, the Northeastern Regional Conference of the Indian Association for the Study of Population, I would like to share a few details about what happened in the last 2 days. The theme Demography, Health and Development, Insights from Northeast India, has served as an urgent and unifying call for interdisciplinary, urban-based and local resonant academic inquiry. Across both days, we have collectively engaged with the 8 states of Northeast India: Assam, Arunachal Pradesh, Manipur, Meghalaya, Mizoram, Nagaland, Tripura, and Sikkim. Not merely as locations on the map, but as demographic texts shaped by migration, aging, linguistic plurality, ecological stress, and accessibility. Apart from the plenary session, we have 5 sessions on the day 1 and 2 sessions on the day 2. Total number of presentations during the 2 days included 61 presentations, and day 1 we have around 31 presentations. Day 2 we have 21 presentations. One of the key research shifts apparent across panels was the movement from problem identification to system thinking. Researchers did not merely diagnose social or medical issues, they presented models for surveillance, behavior change, financial literacy, and participatory governance. The plenary session on aging, chronic illness, and health systems in transition gave us a sobering view of the rising burden of hypertension, diabetes, and socio-psychological vulnerability from older adults. We were reminded that aging is not a private issue, but a public policy-driven reality, one that requires coordinated attention to social security, chronic disease management, and community-based care models. Another important issue discussed by the scholars in the pattern of migration from Northeast India, the economic and social cost of internal displacement, and the reality of undocumented migration, and the growing need to align employment policies with migration threats and aspirations. Through this conference, we address this critical question of data visibility. Presenters working with MSSO, NFHS, HMIS, LA, LASI, and other data systems highlighted both the utility and limits of such data share. In doing so, many presenters made a compelling case for integration of quantitative metrics with community-driven qualitative insights. It is not exaggeration to say that this conference has set a multi-stage research ground. As we part ways, let us not think of this conference as a conclusion, but as an opening for regionally anchored collaboration, for data sharing and open access determination, and for the emergence of Northeast India and not just a recipient of development discourse, but as a generator of it. We are immensely grateful to IASP Executive Council, our participating researchers, the technical and student volunteers, and our partners for making this meaningful. Special thanks to our early career researchers whose work has shown us what the next generation of population science can become. Many conversations will continue. The insights from these days take shape in the policy, practice, and parallel.
Thank you, sir, for encapsulating the highlights of this remarkable event. It is now time for a conference reflection, a moment to look back to the journey we have started over the past days, for which I invite Dr. Ajay P. Singh, Joint Secretary and Regional Coordinator, IASP, to offer this reflection.
Good afternoon. So, it's been a good day for last 2 days. Hope we will continue to engage, continue to discuss, and continue to talk about this memorable day. So, in next few minutes, I'll be talking about the different sessions, what was the discussion was had, and I'm also sharing the photos of yesterday's, but they're not related with each of the sessions. So, you can excuse me. Just to give an overview that there were there were 7 technical sessions and number of papers which were presented were 46. There was 1 plenary session and there were 2 parallel sessions which was done yesterday. And just to give you an overview of the inaugural session, which was presided by our Honorable Vice Chancellor, and he gave a very thought-provoking address which highlighted unique demographic and health challenges that were in Northeast District. He also emphasized that the importance of a state-specific program tailored to regional context. Then Dr. Ajay Singh also talked about basically when he was opening remarks and highlighted the different challenges of Northeast regions. And Professor Suresh Sharma, President of IASP, delivered a presidential address which underlined the role of population services in driving inclusive development in the region. Dr. Anil Chandra, General Secretary of IASP, offered concluding remarks. Dr. Jiten Yadav, then rather edition of Demography here, which was released at the end of the inauguration. So the first plenary session, which was on healthcare of population with special needs, social norms, patriarchy, and masculinity. So then we came to technical session 1, where we had like 6 papers, which were presided by Dr. Suresh Sharma. Here are the name of the person, I'm not repeating that. But the key summary of this session was explored maternal morbidity trends, delivery barriers, antenatal care, quality, and maternal nutrition. And one of the papers highlighted the language as a social determinants of healthcare services. So technical session 2, which was on morbidity and public health, was chaired by Dr. Jiten Yadav. And the key highlights were focused on immunization, sleep hygiene, and public health tools, mental health literacy, and cervical cancer. Technical session 3 was on child health and nutrition, which was chaired by Dr. Ajay Singh. And key takeaway there undernutrition and undernourished children, antenatal care, determinants, child dietary diversity, and breastfeeding trends. Technical session 4 talked about causes of mortality and morbidity in Northwest India, which was chaired by Dr. Anil Chandra. And key takeaway there the disease surveillance, traditional medicine, breast and cervical cancer awareness, gamma treatments, and cervical nutrition. And then on session on fertility, sexual behavior, and population dynamics, which was chaired by Dr. Neil. We had 7 papers. And it covered infertility, reproductive health, population aging, demographic challenges, pre-pregnancy, and migration-related influences. Session on migration, livelihood, and socio-economic condition, which was chaired by Professor K. Thomas, which had 7 papers, and it discussed on migration intentions, NRL impact, gender impact of migration, public spending, STI and risky behavior among youth. The last session was chaired by Dr. Anil Chandra on health system aging and chronic conditions. It had 7 papers, and it examined chronic conditions, longevity disparities, healthcare costs. There were C-sections study, repeated C-sections, and psychological stress from human from across Northeastern, and also as far as from BHU, IAS, Bombay, and also Borough University, and so forth. Thank you so much.
Thank you, sir, for your insights and sentiments. Let us now open the floor to our conference participants for their brief reflections and feedback. We may have only 4 participants to share your valuable feedback to the instructor conference.
This feedback is very important for IASP association. We want to improve, whatever, there is any problems or changes or anything. So next conference we can take care of it. If you have, please. Yes.
Yeah. You are very well organized. You were well organized regional conference, and decide environmentally and also there are no problems. But it's any area. Still that some will take several time and all this stuff. So I think, but also the very volunteers were there, and being a regional conference, less number of speakers, one has enough time to not to tell the story. Because I think the main conference is that of the way. They want to change the whole India demography or something. It looks like they have only the kind of brain on that. But anyway, like regional conference, quite good. And then every topic it was. And especially what was coming to my mind is that because all the states have very different different type of people, different way of doing. So putting like something like all those, if you tell anything, it is very difficult. Like it means when you say something, any kind of change in Bihar, UP, Rajasthan, it has been similar type. But here, like different community and this one needs to have a more specific policy for their development. But anyway, much of things are changing, and the years to come, maybe quite. I have seen that earlier government used to be very less important to this area, maybe because of infrastructure development and all this one, very costly. But now, in a 2-3 years, maybe much more change will come. And so that way, and also I'm thankful to the ISP for maybe very well, because last year I went to Bodoland. But Bodoland was not like this type. It was more plain. It was plain area. So it was really very enjoyable, and I hope maybe people have enjoyed. Thank you. I think this place gives us a feeling of Himalayas. We are there with Himalayas in the map of Himalayas. And I must congratulate the team of ISP. They have been organizing our speaking conferences. Going to far from India, like Himachal, then we go back and all that. So this chain of regional conferences is something very good. So we talked about the regional issues. Sometimes they overlap at the national level. National level is we may not be going into the implications of small institutions. So they really needs to be implemented for this, and I think this again should consider people also. And the other is the SRM University, which is a good
welcoming students, it's a scholars and students, everybody smiling face, welcoming all of us at any time, at any moment, very positive. So that's, I mean, you feel in a different world when you come to this campus and you talk about that. And the young researcher, I would say, this is not the end. They have come out with their research topics, presented the things, they have got many suggestions, and this is not the end. Continue with this. You have given and you have got a lot of suggestions. So try those suggestions. See if things come back. Not that all suggestions has to be implemented, but yes, if they are there with suggestions, if they are there with methodologies, they must attempt, and see if your work gets better. So with this, I really enjoy it here, and I wanted to come. That was my one dream, was coming from Himachal to this place. I wanted to see the place, the Sikkim and the flora, fauna, and the people of life. And it has been achieved, and I really feel very happy about it. And thank you. I give all my good wishes to the Vice Chancellor, his team, and the university. We will do very well in future, and call us again.
So, we got opportunity to present our research on the different topics. Basically, we got to know the impact of the Northeast, like when we think about the India. So, Northeast is a part of the India, where culture is completely different, where history is different. So, these insights from this conference. So, along with that, I would like to request IASP to continue with this special conference. Other than the technical system already progressive and knowledgeable. So the SRM University, the way they are managed, order to the time, presentation of time, especially thanks to the teachers that Krishna and who had supported us during our time to get to the new place in SRM, taking updates on our passport and our hometown and our planning to talk. Genuinely able to reflect. I also like to thank the student volunteers who have supported during the student. Thank you.
I just want to say a few words. I want to thank for conducting this conference. This is my first time being in this since I'm just a first year student, and I'm so happy. And I just want to say thank you very much, and also for my department, especially from Sir National Manager. I want to thank them. They are very supportive, and this topic also will be for my research internship. So I will, with the suggestion that have been given, I will work more. Thank you.
Only, I have one announcement. Very good. I request all the participants kindly send the full picture, and I will send the reviewer selection of this paper. So I request to all the participants and submit to me. Revise your paper, whatever you receive the comment and suggestion, send to IASP, and we can publish a special volume.
Thank you all for your valuable feedback. It will surely help us to improve and grow further. We are now honored to invite Professor C.H. Satish Kumar, the esteemed Vice Chancellor of SRM University Sikkim, to deliver his special address. We look forward to his inspiring words and visionary insights.
Respected my friend Dr. Suresh, listed IASP, Dr. Anil Ji, Dr. Ajay Ji, Dr. Thomas, and Dr. P.P. Singh Saab, and Dr. Vishkar, and Dr. P.P. Singh Saab, and other dignitaries, other people who have attended the function, and our own field volunteers. Good afternoon, everyone. Valedictory is always two feelings. Actually, one is that sense of success and sense of pain for separation. So this contest is more than we enjoyed more because I met many people after 20, 30 years after got a lot of nostalgia, and after my teacher Dr. Ravi also came, and I want to tell all of you that SRM is an academic institution. If our students and teachers and our own people don't take the opportunity as a learning platform, then we do the great chances. I really appreciate our students and our public health and other student faculty who came forward and presented the papers and attended some of the sessions and came back to me and started discussing about the papers. Why I'm telling that? So there are 51 papers and 51 dimensions of demographic changes of Northeast you have brought in, and that will spark the ideas of research, sparks the academic endeavors, I think academic journeys among our students and our SRM University. And after the conference, there will be a debate in what are the areas we are going to work on. There our public health is going to talk about, Thomas and Pete is going to talk about that. And we will start our process of working on this. Still, we are stick to the word that demography, tourism, and all three companies together go in Northeast. We want to take it forward, and it's what more than you all. I think we benefited a lot directly and indirectly and academically and professionally. And thank you very much for all of you to come such a distant place. And many of you could travel, I think, pain of traveling 4 hours, 5 hours from Baghdad to Beach. We always invite people and how will they come actually then, or people keep on calling them any problems in between and see on. But luckily this time, all of you had a nice, wonderful time because there are no landslides. If landslide happens, there are at times even I traveled 8 hours, 9 hours to reach Gangtok from Pakistan. Night 2 o'clock before to reach. So these things happen here, but we never get bothered about all these things. We never get perturbed with all those things. But I never said anything that oh, there's a lot of problems. I never had the problems, and we always enjoy the challenges. That is what Northeast great to us. Enjoying, I think, enjoying the problems and countering the challenges. That is the Northeast. I think together Northeast. That is the culture of Northeast. So, if one road is not there, Delhi, Bombay, Bangalore, the pothole they get, TV may they repeatedly they show it on the TV. Bangalore में कितना potholes है, यहाँ road भी नहीं होता है, but Northeast people never complain. They wait for the opportunity to help. That is the message outside there. Another important thing I think all of you should go back. I think one important is when we always feel that you have seen that our drivers having a lot of traffic. They never buzz their horn. They never honk their horn. So they have the patience. The patience is a key for Northeast success. I think they learn from here. The drivers and other people from outside, Northeast has given this how to have the patience, the resilience. They are the powers of Northeast. I think that is much. That's what our training people train that we should learn. I think all of us have experienced that already. And another thing is that Sikkim people, we have a very different concept of. I'm very straightforward. I tell on the face. That's the feel about it. But the one beauty of the Northeast people, they will not hurt you. They will absorb you. They whatever you say that. I think this is not telling because I am some North people are here. I am not praised. This is my observation of 10 years. They don't like. They become silent and they don't talk. So in our culture, we are a bit, I think, expressive, over expressive. We always say that they say proudly and straightforward. I was also also like that. I used to think that before coming here, I'm very straightforward. I can tell on the face. What is that straightforwardness to hurt someone? That's what I think we feel as a proud attribute, which is one of the worst attributes many of our leaders, most teachers, many teachers also carry that. That lesson I got it from office. Okay? Absorbing the others' dissatisfaction, others' express, absorb it, and let on you. These are very important attributes, sir. I think already you must have experienced one of our days who have come from the areas, and this is a and this culture is all over the office. What I'm telling these attributes, not only specific to Sikkim, and that's why I'm telling that what people have brought into the Northeast and what you think is back to the about 10 years, it's actually very important to observe and really appreciate Ajay sir. It was a wonderful reflection, and the reflection has many of my photographs more than in my marriage album.
And still beautiful.
Thank you very much, and I really appreciate the Suresh sir. Suresh, then for them, sir, and for provoking all to write the full paper and bring it to the democratic journal. Don't leave it opportunity. Please do that. Okay, this type of support very seldom people will do. They have pleasure of rejecting, pleasure of deleting. We have a higher level, but these are I think IASP is having pleasure of accepting, pleasure of promoting. That's what they are doing. Please do it even for our scholars who have done it. Make a list of it and we give you the how many have done it. Thank you with you. And that will say, from the core of my heart, I want to thank this sir for giving that wonderful cap. Yeah, I always look for that cap. Thank you very much, sir. You brought back many nostalgia. Thank you. I want to end here. I want to keep on talking, but we are getting late for the lunch. Thanks to once again to the IASP, as well as the wonderful participants and senior demographer who came here. You are most welcome whenever you want to come to Sikkim, sir. And give us a name to town. We'll look for an opportunity to bring you from Bangladesh here. We'll host your stay here for Sikkim. And only thing of the expert greedily is that talk to our students for about the demography health. Thank you very much.
Thank you, sir, for starting upon us your words of wisdom. To bring this formal session to a close, I now invite Dr. Anil Chandran, General Secretary, IASP, to deliver the concluding remarks.
Respected Satish Kumar sir, our wonderful Vice Chancellor, Mr. Suresh Sharma, the President of IASP, other esteemed guests on the dais, off the dais, and my dear participants. We are coming to the end of this 1.5 day conference on demography, health, and development in the Northeastern region. Though this conference is just 1.5 days, in fact, it takes more than 3 months of planning and implementation to actually come to a successful conference. There were a lot of people actually worked behind the screens to make this a successful event. If we feel that the conference was a success, a lot of things are deliberated, a lot of enjoyment, including very nice food, good accommodation and everything. There are a lot of people actually worked behind this, and one person we have to particularly thank is our Honorable Vice Chancellor. The leadership is very, very important. Without a very supportive leadership, no one can actually work like this. With their team, SRM Public Health